comes to your health, there are some topics that are tough to talk about with your family, especially when it has to do with your colon. But these conversations are important. Pat Monson and Brian Sean share their stories on behalf of Live Like Rach Foundation.
As we continue with March Colorectal Cancer Awareness Month, we want to emphasize the importance of family history and that people are sharing their family histories relative to diseases, including colorectal cancer, much earlier with their families and with their providers. 25 to 30% of patients with colorectal cancer are genetically connected to family members. In Rachel's case, both her grandfather had polyps and her great-grandmother had colorectal cancer that was diagnosed at a very early age. None of this was disclosed to her providers because nobody asked, even though she had all of the symptoms of colorectal cancer. Another very important factor in discovering colorectal cancer is to have genetic testing to find any types of inherited genetic mutations. With me today is a familiar face to most of you, and that's Brian Sean. Brian just joined the Live Like Rach Advisory Board, and he's an on-air personality at Midco. Brian had his own scare with Lynch syndrome, and he's agreed to answer some questions about what that's done to his life and his involvement with that. Brian, how is it that you discovered you had Lynch?
Very dumb luck, quite frankly. I did not realize the family history that I had. That my grandfather died of colon cancer at 33, that my dad's oldest brother at 22, that another one of my uncles, another one of my cousins is run rampant in our family. And I just had genetic testing done because I kept receiving messages about it, kept getting phone calls about it, just signed up for it. And then even after I was accepted into it, it still took me 9 months to go get the test done. And once I finally did, because I was in for a physical and they just took extra blood to check it out, I got a phone call a month later and said, "You tested positive for this Lynch syndrome. Your chances of colorectal cancer are about 60% in your lifetime. You should really go in for a colonoscopy," which I did 6 weeks later. And that's when they found a stage 3 tumor. And within a week, I was having surgery. And not long after that, started other treatment with chemotherapy and immunotherapy. So it was kind of a wild ride, but I was very fortunate I found out when I did.
And prior to that time, there had been no discussion in your family about colon cancer or this genetic mutation called Lynch syndrome?
Not really. Not that I had really heard. I had not really heard how my grandfather died or how my dad's oldest brother died. It was not really discussed with our family, at least not openly with us. So I do encourage people to have that conversation with their children, especially if something like colon cancer is running rampant.
Is that a reason? Is there any reason you can think of to not have a discussion about colorectal cancer?
No, I know sometimes it may not feel very comfortable. You know, Lynch syndrome, again, colon cancer is only one of the cancers that can be a result of that syndrome. Ovarian cancer is also a big one on females, but colon cancer is the single biggest risk for young people as it continues to go along. More and more young people are getting diagnosed with it. It's not something that is necessarily screened for at an early age, so you really have to pay attention to the signs and symptoms of that you do have. But if you do have a family history, it is important to go in for testing as early as 25 years old to get this done. It is significant to make sure that everything is running okay.
So if found early, colorectal cancer is treatable, it's curable. If you have any questions at all about Lynch syndrome, the signs and symptoms of colorectal cancer, please go to livelikerache.org. Thank you. Thanks, Brian.